Hello, and welcome to another episode of Random Health-ish. I am your host, Dr. Gloria Stone-Ozbek, and I have some great information for you today. So first, let's kind of dive into why I actually created this show, Random Health-ish. So I've actually been wanting to do something like this for a really long time, but I couldn't really wrap my mind around exactly what it is that I wanted to do. So it crossed my mind that I wanted to talk about chiropractic, but I also get so many patients into my office that are struggling with other issues that I have to refer out for. So I came up with the idea to create Random Health-ish so that I can connect with those other providers that I sometimes would refer out to so that I can educate the masses on their specialty and what it is that they do. Because what I'm finding is a lot of patients go to the doctor, but they don't know exactly what the doctor is treating them for. I've had patients come in that have had surgeries and they have no idea exactly what surgical procedure that was done to them. So I think it's important that we educate ourselves on what is being done to us when we go to various healthcare providers. For instance, next week we have a family therapist that is going to be joining us, Ms. Gabrielle Williams. So she is going to be talking to us about family therapy, whether it's marriage counseling, whether it is your child, you have a child that's kind of struggling with some things. Maybe there was a death in the family, or they're struggling with other things with school, and the pandemic is really kind of coming down on us in a lot of different ways. So I am so excited to have her on. And then also we have a doula coming on the week after that on the 21st, Miss Mariah. So she is going to be talking to us about childbirth and about lactation and about the various options that pregnant moms have when it comes time to giving birth to your child. So that is why I created this show, and I'm so excited. I am getting a lot of interested people that have been responding, and it is going to be so awesome. I have a few more people. We have a speech pathologist that is going to be coming on as well. I am currently looking for someone who works with kids with autism, because I am noticing that there is an increase in kids on the spectrum, especially in the Black community. So I would love to speak to someone about that so that we can get some more information to our parents and to, really know the protocol and know what we're supposed to be doing as well. So that's why I created Random Health-ish, and I hope you guys continue to tune in every Monday at 7 p.m. And I want to dive into a little bit about some health tips that I know you guys have been struggling with and that sometimes people ask me about privately. So a lot of times I get the question of, what can I do at home? So you come to me, you get adjusted, you're feeling better, and you want to know, okay, what can I do at home to kind of keep, myself in check? So the first thing is I want you guys to really start paying attention to your bodies, because a lot of people, we are just always on go mode. It's just go, go, go. And we never really take time to relax and really listen to our bodies. Like, are my muscles tight? Like, what did I do today to aggravate myself? Like, we have to start paying attention to the little things, because when you come in to see me, I don't know how to treat you if I don't know what it is that you did to trigger whatever is going on in your body. So I need you guys to pay attention to that. Another thing I want you guys to do is to stretch. A lot of people, they constantly are talking about, oh, I go to the gym, I work out and all this stuff, but they don't do the most important thing, which is stretch. You wonder why you got low back pain and you got all this stuff going on and your muscles are super tight. You have to stretch, you guys, okay? I cannot stress that enough. Because a lot of times at your job, and especially now during COVID, a lot of people are working from home. Okay, so you're sitting down a lot, you're in front of the computer a lot. So it's important that you stretch your muscles out. So I'm going to give you a list of muscles that I want you to look up on YouTube. I am going to create a video for you later so that you can know exactly what to do when stretching certain muscles. Okay, so if you have a pencil, you got your little notes out, write these muscles down, just a few. Okay, I'm not going to give you a whole, whole homework assignment over here. So the first muscle, if you're going to be sitting down a lot, sitting in front of your computer and things of that nature, the first muscle I want you to work on stretching out is your psoas muscle. I know you're probably like, Doc, what is your psoas? What is that? Okay, I'm going to spell it out for you, okay? It is P-S-O-A-S, psoas. The P is silent. Okay, so where is your psoas muscle? Your psoas muscle is actually right in the growing area. So when you're sitting down a lot of times that psoas muscle can get really tight. It can pull on the pubic bones, which will kind of give you pubic pain or pain down your the front of your thighs. So we want to really make sure that we are digging in and stretching those psoas muscles. So again, like I said, I will be making a video at a later time showing you different stretches that you can do at home. Okay, so the next muscle or the next set of muscles that I want you guys to focus on is just basic low back stretches. Okay, that's bending over, touching your toes, okay? Sitting down on the floor, putting your feet together and just stretching forward, okay? We want to stretch out that low back as much as we can because a lot of people, they get more tightness around this time of year when it's really, really kind of cold outside. So you wake up stiff, but you got to think about it. You've been walking around all day doing whatever it is that you do. And by the time you get home, it's all about cooking, cleaning, taking care of the kids. It's like you never really get a chance to kind of, sit down. So by the time you take your shower and lay in the bed, you never stretched before you went to bed. So you wake up super stiff from all that action the day before. Okay. So we want to work on stretching that low back. Excuse me. The next thing we want to work on stretching is the hamstrings. Okay. Hamstrings. Do you hear me? Okay, so where are your hamstrings? Your hamstrings are the back of your thighs. Okay, and a lot of people forget to stretch the hamstrings out. But when you have tight hamstrings, it actually pulls on the pelvis and brings the pelvis kind of backwards a little bit. Okay, so we want to make sure that we are really, really stretching those hamstrings out. Okay, it's almost like a domino effect. The next thing we want to stretch out is the quads. So the quads are the front anterior of your thighs. And you could just kind of stand up, bring your foot back. You can hold onto the wall if you need to, and just kind of stretch those thighs out really good as needed. Okay, so I'm laughing because PJ just said his are tight now. But yes, those are a few things that I want you guys to work on. That's your homework. Okay. Another thing I want to talk to you guys about, especially the guys. Okay. I cannot stress this enough. When you come in my office and your wallets are this thick, okay, they're this thick and you're sitting on those wallets when you're in your car, when you're in your truck, when you're sitting at the doctor's office, and you're sitting on this, it is throwing your hips out of alignment. Every time a patient comes into the office and they have that wallet in their back pocket, I say to them, do you always have this wallet in your back pocket? Are you sitting on this wallet? It seems so minute. It seems so little that people are so used to doing it that they don't think that, okay, maybe something is wrong. This is a big cause of your low back pain. Again, like I said, it's like the domino effect. You're sitting on your wallet and it's making your hips misalign, okay, because it's not balanced. Look at that. Look how thick this is. You got to do better, guys, okay? And I already know. Oh, well, where am I going to put it? Put it in your front pocket. Wear something with a lot of pockets. Get a man bag. Do something. You got to be creative. But you definitely have to toss, again, yeah, Shalandra, you got to toss those thick wallets, guys. It's not doing you any good. is actually making your situation worse. And then you come into me and you want me to create and work a miracle. And it doesn't happen that way. Okay, so the next thing I want to talk about, I've actually addressed this before in a I've actually addressed this before in a previous video when we're talking about the way that we sleep and we're talking about our sleep habits. So a lot of times, especially if you're like me, I sleep on my side. Like that is my go-to. Okay. Sleeping on your side is actually not the best position. It's like the second best. Sleeping on your back is the absolute best position. But my go-to is the side. I mean, hey, it is what it is. I'm not here to sugarcoat anything. That's what I do. So what can you do to prevent your hips from misaligning by sleeping on your side? So one thing we always like to recommend is we like to recommend sleeping with a pillow between your knees. So I'm going to pause right there. Okay, if you're like me and if you just use a standard pillow and you put that thing between your knees, the next day that thing will be over there across the room. So what I always recommend is if you are going to do that, to get the full size, super long pillow, the pillows that the pregnant moms use to put between their legs when they're sleeping. That body pillow will actually really, really help keep your hips aligned when you're laying on your side. Because when we're laying on our side, the first thing that happens is you bend that knee and then it's hanging over your legs, okay? We want to stop doing that. Okay, we want to stop doing that. We want to create better habits, you guys. It's all about creating better habits, things that we do every single day. Okay? Do y'all hear me? Are y'all listening to me? Okay, so another thing, and I know, so I already attacked the guys, so ladies, it's coming for you. And I know I'm not the one to talk because y'all, the people who really know me, y'all know I love wearing heels. Like I absolutely love wearing heels, okay? So when I say this, take it as you will. But when you are wearing heels all the time, it's putting a strain on your back and it's rotating your pelvis forward. Okay, so I'm not saying don't wear heels. That's unrealistic. And I'm not unrealistic. I'm being real with you. I'm not saying don't wear heels. But what I am saying is if you are going to wear heels, try to just kind of, limit it. If you're going to be just try to limit the amount of time that you're going to be in heels. Like if you're going somewhere where you can kind of put on some flats or, throw some sneakers on real quick until you get to where you're going or, to take a break, then do that. Okay. Because, the one thing you don't want to do is when you get old and then you start having all these issues because you don't wear 6-inch heels your whole life. Okay. So I'm trying to save you here. Okay. I don't want you to be 80 years old crawling up into my office saying like, oh, in your little kitten heels, okay? Because your knees went bad. Okay, another thing I want to talk to you guys about is the type of sneakers that you wear. So I'm not going to dig too deep in that because a lot of people think, oh, because I spent this amount of money for some Jordans or some sneakers, that doesn't mean that they have the best foot support. Okay, so we got to take care of your feet because like I said, it's a domino effect. So if your feet are not being taken care of, then your knees go out and then your hips go out and then so far and so on. Okay, so take care of those feet, you guys. All right. So I always recommend custom orthotics if you have access to that. If you don't have access, look at your feet. When you're standing straight up, look at your feet. If your feet rotate inward like this, you want tennis shoes or sneakers or whatever you call them. You want shoes that's going to support the inner part of your foot. Okay? If you walk on the outside of your feet, like this, you want shoes that are going to give you a little extra support on the outside that'll kind of balance you off. So that's going to help out your gait. Okay? Some people have flat feet. Some people have a high arch. So you really have to, that's why I always recommend custom orthotics, because the custom orthotics are going to conform to your foot. Okay? So we got to protect the feet, because if we don't protect the feet, we then begin to have knee issues. Then after we start to have the knee issues, then we start to have hip issues. After we have the hip issues, then we start to have low back problems, misalignments. I don't want to say a scoliosis, but you start to have what we call a list in the spine. Your spine starts to kind of lean to one side a little bit more than the other. Okay, so protect the feet, which will help your knees, which will help your hips, which will help your low back. Okay, protect those feet, you guys. All right, so now I'm going to talk to you guys a little bit about, I had a health scare, you guys. Oh my God. So I never get headaches. I never get headaches. I'm one of those people that are like rarely ever sick. Okay. So one day I'm at home and I'm like, oh my God, I got a headache, but I didn't think much of it. And then all of us, the next day, the headache got so bad, you guys. Like, oh my God, the headache was so bad. I had to close the windows. I had to turn off the lights. Like, it was a horrible migraine, and I don't get migraines. So it went on for days after days after days. And I'm like, oh my God, I'm thinking like, do I have coronavirus? I'm like freaking out, like, what is going on? You know what I'm saying? So that Sunday, I told my husband, I was like, you know what? I think I'm about to go to the hospital because something is wrong. Like, something is really wrong with me. Went to the hospital, y'all. They did blood work. They did a brain scan, okay? Pregnancy test. They did everything except a COVID test. They didn't do a COVID test. And so I think I was there for a few hours and they were like, everything is fine. So now I'm like, well, what is going on? Is it like mold in the house? I'm like, I don't know what to do, y'all. I don't know what to think. So then after that, it went away. The headache went away. And then the headache came back again. And so I'm like, oh my God, y'all, I'm about to die. Something is wrong. What is going on? And so I went, I ended up figuring it out. And so guys, guess what was triggering my headache? It was my Bath and Body Works body wash. Can you believe that? That's crazy. So I say that to say this, which is my ultimate goal, is to get to a point where I am using natural products, making my own soaps, things of that nature, because a lot of chemicals that are in the products that we purchase are causing issues, you guys. And this is serious. Like, I am really serious right now. There are being links to the deodorant that we are wearing, the aluminum in the deodorant. They are linking that to breast cancer. Okay? Linking that to breast cancer. Some of the cleaning supplies that we use, the stuff that we are inhaling, the fumes and stuff like that. That stuff is not healthy for us, you guys. Like, you got to make sure you're opening windows, you're airing that thing out. Don't be in no enclosed space with all the Clorox all over the walls and stuff. We have to be careful about the lotions and stuff that we are putting in our bodies, you guys. There are chemicals in these things. And we have to be mindful of what we're doing, what we're putting in our bodies and on our bodies, on our hair. I'm not I'm not going to talk about perms and color and stuff like that because, I just got some color not too long ago. But we really have to be careful, you guys, because I really believe that, of course, what we do now is really going to affect us when we get older. And we have to be mindful of not only what we put on our bodies, but what we're putting in our bodies, how we're eating. You know what I mean? So a lot of people think that, oh, okay, my grandma had heart problems. They had cancer. Cancer runs in my family. That may be true to a certain extent based off your genetics. But the other factor that goes into that is that it's also your diet. It's what you're putting into your bodies. Yeah, you have type 2 diabetes, but for some people, when they exercise, they eat good, they are able to reverse that. Not for everybody, but like I said, for some people. And so I'm hoping that when I get a few doctors on, they're going to be able to talk to you guys about these issues. It is throwing our hormones off. We are at a point where the infertility rates of women right now have dropped dramatically. And part of that is because of COVID-19, a lot of us have just kind of been inside, not really going anywhere, not really exercising, not really doing much. And we have, started living a more sedentary lifestyle. You have to get active, even if it's just walking around the block. You know what I mean? You don't have to, walk a full marathon every week, but you have to get active. And you got to start watching what we put in our bodies. And if you know me, I love to eat. Okay? I love food. Okay? But even now, right now, so every few months, I do a plant-based diet for about a month. And I'm actually just started again this past Saturday. And I do it in an effort to just kind of cleanse my system out from all the junk, all the processed foods, all the dyes, all that stuff that's in our food that we don't even really realize. I do that as a way to kind of detox my body and give my body a break to rest and reset. Okay? So Saturday, so what do I do? What does my plant-based consist of? I do a smoothie in the morning. I made a stir fry of like squash, zucchini, onions, corn, and then I put it over the rice. Y'all saw Justice ate my rice today. Y'all, I was pissed. She ate all my rice. When I came home, y'all, I had my mouth tuned up. So spread my little veggies out over my bowl of rice, and I came home, y'all, and that girl ate all the rice. So I do things like that. Whole Foods has a really great selection. And when I do plant-based, I do vegan plant-based for the most part, with the exception of honey, because I love honey. So that's one reason I don't think I can ever truly be a full vegan, because I love honey. And to me, honey, when people get the honey from the bees, they're not hurting the bees. So I'm okay with it. But yeah, so I do stir fry. Whole Foods has a great selection of they have this plant-based eggs. It's called Just Eggs. I don't eat regular eggs anymore because they actually they make me sick to my stomach. So I don't eat eggs. But I really love Whole Foods Just Egg. It is so delicious. I don't really too much care for the fake meats, but Field Roast has a great vegan sausage. They have a spicy one called Chipotle. And sometimes what I do is I put it in the blender, I grind it up, cut up some onions in that thing, and then I saute it and I put it over some nachos. And, they have plant-based cheese. So I just sprinkle that thing on over there and I tear it up. Y'all, it'd be so good. So what did you learn from this event tonight? let's do a quick review. All right. First, we learned why I created Random Health-ish, right? To inspire other people, to educate the masses on various healthcare procedures and protocols that we don't quite understand, to give us more insight and to know what questions to ask when we go to our healthcare providers. Because a lot of times we don't ask the right questions. We don't know what questions to ask. So I'm hoping that this show will be that for all of you. Another thing that we learned about stretching. We learned about the psoas muscle. All right, PSOAS. Okay, psoas. We learned the low back stretch. We learned to stretch our hamstrings, to stretch our quads out. We learned about our men wearing those thick wallets in their back pockets. Take it out. Don't do it. Okay? Or you're going to be seeing me sooner than you think. We learned about proper sleeping positions. The best position is to sleep on your back. A lot of people like to sleep on the side. Sleeping on the side is going to cause you some hip issues if you don't have the pillow between your knees. But sleeping on your side also can cause shoulder issues too. So if you notice after you slept on your side and your shoulder kind of feel a little stiff the next morning. But that's why I said it's the second best, not the first best. The best is sleeping on your back. Second on your side. The worst position is sleeping on your stomach. So I know y'all out there sleeping on your stomach. It's the worst position, and that's why your back hurting right now. Okay. Okay, and then what else did we learn? I told you guys about my health scare. So we learned that, using all these products, all these chemicals and stuff like that is really affecting us in a major way. So we want to take back control of our lives by using more natural products. If you don't know what natural products to use, go to Whole Foods, guys. Just walk around. I love going to Whole Foods. I feel like I'm in like a little amusement park every time I go in there because it's like some new stuff I ain't seen before. Okay. So let's work on doing that. And don't forget, if you do decide to go to a natural deodorant, we want to detox those armpits. Okay. We're Dr. Oz. How do I detox my pits? You try to switch to that natural deodorant and you stinking up the place. So, so you got to detox those armpits, guys. How do I detox my pits? You buy Indian healing clay. I like to mix mine with vinegar. First of all, you should just buy Indian healing clay anyway, because if you got pimples on your face, if you have like acne and stuff like that, you need to be clearing up. Like I need to do a face mask right now. Okay. That Indian healing clay, mix it with a little bit of vinegar, but you got to make sure that the texture is right, because if it's too thick, it'll make your face feel super dry. So make it a little bit, a little extra soupy. It will clear your breakouts up. Okay, I'm telling you, like it will be like that within 24 hours. So anyway, Indian healing clay, put that under your pits, let it sit, let it dry, wash it off. You may want to do that 1 or 2 times, depending on, how long you've been using your regular deodorants. Okay, it's really good for kids with little funky pits, because when they start hitting about 3 or 4, honey, them pits, those pits are something serious. Okay, so yes, take all this stuff into consideration, you guys, and I hope you guys have a really blessed night. If you have any questions, please drop them in the comment box below. Make sure you tune in, guys, every Monday night at 7 p.m. Central Standard Time. I will be here. And again, make sure you tune in next week, guys. We will have our family therapist and marriage counselor, Gabrielle Williams, will be with us next week. And she also works with adolescents. So if you have troubled kids and stuff like that, I will be, if you subscribe to my Facebook, YouTube, and Instagram page, either one of those or all of the above, I will be posting her information as well if you guys really need to get in contact with her. okay? Because that stuff is really important as well. All right. So make sure you tune in every Monday night. I love you guys and be blessed. See you next week.